In Ebonyi State, availability of commodities at the health facility has been very low. Few providers were trained on family planning. Breakthrough Action Nigeria undertook community approaches by including community entry activities to engage key stakeholders alongside advocacy, high-level key community leaders to secure commitment and build support for the program. Subsequently, 86 CVs were deployed across 76 wards. The CVs and WDCs conducted community mobilizations to implement activities on adopting healthy behaviors.
They trained me on childbirth spacing. So after the training, I was sent to my ward to advocate for childbirth spacing. So there, before we started, it was challenging. But as time goes on, we gain the interest of the community.
Training of mass media producers, co-development of materials, equipment support, and documenting community experiences improved success.
Based on the publicity and even how it was being dramatized, what it takes for family planning, in other words, planning your home, how you will be able to accommodate within the resources that is within your limit, and then bring them up the way they should, within the context of the society.
In 2018, the SMART survey conducted showed the CPR was at 26.5%, which is a net improvement of 18.8% increase in commodities uptake across the health facilities and communities of support. There was significant improvement in counseling outcomes and spousal support for FP uptake.
The activities done at community level, LGA level, state level, the activities increase uptake of family planning and build capacities both of state officers, LGA officers, and community people. So for me, it's a great work Breakthrough Action has been doing and is still doing in the area of family planning in particular and public health intervention in general.
For several years, Ebonyi State had witnessed low insecticide-treated net ownership and use with poor representation of malaria information in the media.
There are other aspects of malaria that Breakthrough Action has helped us to improve on, and that is on the use of insecticide-treated net, long-lasting insecticide-treated net. As they go from house to house, one of the things is to find out whether the household have net. If they have net, are they sleeping inside the net? How to hang the net? If you have the net and you don't know how to hang it, the community volunteers were taught on how to hang the net.
We're happy that Breakthrough Action went to malaria because we know malaria is endemic here, and we know it is also it has high burden among women of reproductive age, pregnant women, children under 5. So they are going to that area, still supporting the state, and it complements reduction of maternal and child mortality, which we are looking out for.
Breakthrough Action Nigeria mapped and committed relevant stakeholders such as LGA actors and key partners. Trained 198 community volunteers across 4 LGAs that worked tirelessly to generate demand for malaria services at the health facilities. Over 150 malaria media content were produced for TV and radio. According to NDHIS 2018, ACT use is 78%, ITN ownership and use 65% and 76% respectively. Breakthrough Action Nigeria ran 2 vertical programs, Family Planning and Malaria SBC, and now transitioning to an integrated SBC program, which includes Maternal, newborn and child health plus nutrition in Ebonyi State.
So in transitioning from a vertical program to an integrated program, one of the first things we did was to have statewide engagement discussions with state officials, Ministry of Health at the state level, at the LGA level, and also down at the ward level. Additionally, we also planned for formative assessment, which we call the HCD process, to also understand people's lived experiences. We also had another assessment also down at the ward level, where we also tried to understand the existing community structures, because we have an approach, the CCS approach, which we anchor on an identified and agreed community structure or group that can help to support and drive health, greater health outcomes at the ward level.
However, before the integration, current situation shows that percentage of deliveries by a health provider in a public facility is 35.7%. Breakthrough Action Nigeria trained 45 and 60 social and behavioral change advocacy core group members at state and LGAs. These members were trained to influence gender and social norms and improve quality partnership with mass media organizations.
Media has played a very key role during the vertical malaria programming, starting from family planning, malaria programming. We had a lot of trainings, in-depth discussions with the key partner stations to actually tell them that our programming had changed, that we're going to be incorporating messages on maternal child health, nutrition, family planning, malaria.
The state made sure that those community volunteers continues to exist and to do those activities they were trained to be doing by Breakthrough Action. That gave us an edge because activity were still going on in those communities, and then we had to be using our outreaches to reach out to other communities that they were not working on.